my wonderful TM joiners. I'm Priya Mistry, the TMJ doc, and today's video is going to be about TENS, T-E-N-S, therapy. So what is TENS therapy? How can it benefit you and your TMD pain and dysfunction? How can you use this therapy from the comfort of your own home to effectively treat the inflamed and spastic muscles that are contributing to TMD pain and symptoms? Watch this video until the end for the answers to those questions and more. Before getting right into it, be sure to check out my other social media accounts, subscribe to this. The more people that subscribe, the more these videos get pushed out into the interwebs and the more people we can help. The more people that are suffering with TMD pain, headaches, neck pain, jaw pain, ear pain, clicking and popping joints, jaw locking, etc. For those of you who don't know me, I'm a general dentist with a practice in Vancouver, Washington. That's about 10 miles north of Portland, Oregon. And at my practice, we are dedicated to taking care of those with TMJ disorder. So now let's get right into it. What is TENS therapy? Well, TENS, T-E-N-S, stands for Transcutaneous Electrical Nerve Stimulation. TENS therapy uses a gentle, low-current electrical stimulus to reduce muscle spasms and pain. This gentle, low-current electrical stimulus is delivered through sticky pads called electrodes. These electrodes are attached directly to the skin near nerves that are contributing to the sensation of pain. Before I go on, I want to be very clear that I do not want you to rush out and grab the nearest, closest commercial TENS unit and stick it on your face. Please do not do that. You could hurt yourself. In this video, I will be discussing which TENS unit is safest and designed specifically for the small muscles of the head, neck, and jaw. TENS therapy can be incredibly helpful for those of you who are suffering with TMD. For many of you, inflamed, edematous, and spastic muscles of the head, neck, and jaw are playing a large role in your TMD dysfunction and pain, your TMJ disorder. Different muscles come into play for posturing the jaw, opening and closing, chewing, and swallowing. If your teeth don't fit together properly, the muscles of your head, neck, and jaw are overworked to compensate for that imperfect bite. Over time, tight and constricted muscles restrict blood flow and eventually lead to head and neck pain. With TENS therapy, which is gentle, non-invasive, and easy to use, these muscles can be treated and brought to a healthier state without the use of strong medications with even stronger side effects. Another benefit of TENS therapy is that it's portable. If you're on the go or if you travel for work, you can easily take your TENS unit with you to get pain relief when you're away from home. TENS therapy itself is not painful. It's like a mild twitching or mild tingling sensation. And even though it's a mild sensation, TENS therapy can have powerful effects because of the way it works. What happens with TENS therapy, the mechanism of action, if you will, is that TENS therapy provides a gentle, painless electrical stimulus which travels through the skin to nerve pathways. This electrical stimulation gently exercises the muscles controlled by those nerves. The electrical stimulation causes muscle contractions that create a pumping effect. This pumping effect brings fresh blood flow and fresh oxygen to these angry, edematous, overworked muscles. TENS therapy also helps to promote lymphatic drainage, draining out toxins that build up in dysfunctional and edematous muscles. This gentle exercise of muscles, gradual increase in blood flow, and the clearing of lactic acid buildup causes the muscles to relax, which then leads to pain relief. Pain relief usually starts about 15 minutes after pulsing, and in most cases, muscle relaxation occurs 1 hour after pulsing. The beauty of this type of therapy is that pain relief often lasts several hours even after the TENS unit is disconnected and turned off. Are there any risks or contraindications with TENS therapy? Yes, there are a few. Keep in mind that TENS therapy is contraindicated. It is not allowed if you have a pacemaker or a diagnosis of epilepsy, seizures. Do not use a TENS unit when driving, operating heavy machinery, or if you're in the shower, a pool, or any area that is wet. See the user's guide that comes with the TENS unit for any additional contraindications. Because the risks and negative side effects are so few and far between, I would still strongly recommend TENS therapy for anyone who is suffering from TMD dysfunction and pain. Keep in mind that to use TENS to treat the small muscles of the head, neck, and jaw, it must be set or programmed to a very specific pulse width and frequency, and it must also have a fail-safe design to safely limit the current to those smaller muscles. Many commercial TENS units are actually made for larger muscles. So please, please just don't go out and buy a TENS unit and put it on your face. You could really hurt yourself. So please don't do that. So that begs the question, which TENS unit is best for those small muscles of the head, neck, and jaw? Well, my friends, that would be the BNS40, which is a dental TENS unit made by Myotronics. The BNS40 is a battery-operated ultra-low frequency electrical muscle stimulator that's designed specifically for the muscles of the head, neck, and jaw. It is the only FDA-cleared home TENS device on the market for dental use. This includes treatment of TMD and associated pain, increased blood circulation for the muscles of the face and the jaw, and increasing the range of motion of the jaw. The BNS40 is a time-tested, safe, and effective means of drug-free treatment for patients in pain. So where can you get this? Well, first and foremost, you must obtain a prescription. Where do you get a prescription? You can get a prescription from your primary care doctor, your physical therapist, or your dentist. Ask your provider to email a prescription for the BNS40 to prescription@myotronics.com. Once your doctor has emailed your prescription, you can place your order online for the BNS40 and the Myotrode SG electrodes at myotronics.com. Use code Dr. Mystery for 10% off your order. We use the BNS40 TENS unit daily at my office, and the benefit for my patients is enormous. Next up is a quick patient testimonial who really felt the relief with TENS therapy within about 15 or 20 minutes of having it on.
Hi, I have TMJ dysfunction and I have been seeing a doctor for it. And she uses the TENS machine for me. And what I find is she'll put me on it for about a half an hour. And I'd say around 15 minutes in, suddenly all these muscles release and I get a lot of relief from all the pain that I have. And she's able to do better adjustments afterward because those muscles are so relaxed. I think this thing is fantastic.
So that's really it, my friends. Again, I'm Dr. Priya Mistry, and I hope you found this video helpful. If so, please feel free to like, subscribe, and share with your family and friends. For those of you who are looking for TMD pain relief from the comfort of your own home, please check out my free PDF guide called 3 Steps to TMJD Pain Relief. That is linked on my office website. Questions and comments are always welcome. I love to hear from all of you. And remember, my friends, you can never have TMI about TMJ. Thank you.